Hi there and welcome. Quick question. Have you ever felt like Medicare is one giant buffet table, but nobody bothered to give you a menu? You've got Original Medicare, Advantage plans, Part D, Medigap, and somehow they all sound important, but also a little bit like alphabet soup. Trust me, you're not alone. I've helped countless clients who felt exactly the same way. Overwhelmed by the options, worried about making the wrong choice, and wishing someone would just explain it in plain English. I'm Kerri Buckley, and you've landed on Mastering Medicare. Make smart choices with zero confusion. If you're approaching 65 or are already enrolled, you know Medicare can feel like trying to read a user manual written in ancient Greek. That's where we come in. Here at Mastering Medicare, we break it all down. Simple, straightforward, and without the jargon. From understanding when to enroll and what each part covers, to comparing plans and avoiding penalties that can cost you thousands, to knowing exactly what steps to take so you feel prepared and protected. We cover everything you need to know so you can feel informed, empowered, and completely in control of your healthcare decisions. Subscribe to Mastering Medicare, and let's take the guesswork out of Medicare together. Today we're exploring all your Medicare coverage options, so by the end of this video, you'll have a clear picture of what's available and how to choose what fits you best. Let's start with the basics. When you first become eligible for Medicare, usually at age 65, you have two main paths to get your coverage. Path 1, Original Medicare. Path 2, Medicare Advantage. Original Medicare is the traditional program run by the federal government. It includes Part A, hospital insurance. This covers inpatient hospital stays, skilled nursing facilities, hospice, and some home health care. Part B, which is medical insurance. This covers outpatient care like doctor visits, preventative services, lab tests, and medical equipment. With Original Medicare, you can see any doctor or hospital nationwide that accepts Medicare. That's a big reason some people choose it, because it offers flexibility, especially if you travel frequently or split your time between different states. But here's the thing, Original Medicare doesn't cover everything. Here's what it doesn't cover: most prescription drugs, routine dental, vision, and hearing care, long-term care. This is where additional coverage comes in. Option A would be a standalone Part D prescription drug plan. This you would do to get help paying for medications, and you can enroll in a Part D plan, which is offered by private insurance companies. These plans cover your prescription drugs, and each one has a different list of covered medications called a formulary. Option B is Medigap insurance, or Medicare supplement insurance. Medigap policies help pay for costs Original Medicare doesn't cover, like Part A and B deductibles, coinsurance, and excess charges. There are several standardized Medigap plans labeled A through N, each offering different levels of coverage. For example, Plan G is very popular because it covers nearly all out-of-pocket costs, except for the Part B deductible. Here's an important tip. Medigap plans don't include prescription coverage, so you still need a Part D plan if you choose this route. Let's look at Path 2, which is Medicare Advantage, or Part C plans. Medicare Advantage plans are all-in-one alternatives to Original Medicare. They bundle Part A, Part B, and usually Part D. Many also include extra benefits like dental, vision, hearing, and wellness programs. These plans are offered by private insurers approved by Medicare. Most Medicare Advantage plans use provider networks, either HMOs or PPOs. HMO stands for Health Maintenance Organization, and these generally require you to use in-network providers and get referrals to see specialists. Others are PPO, which are Preferred Provider Organizations. These offer more flexibility to go out of network, but at higher costs. Here's a quick example. Meet Susan. Susan travels frequently to visit her grandkids across the country. She wants to see any doctor wherever she goes, so she prefers Original Medicare with a Medigap plan and a standalone Part D policy. Now meet Tom. Tom likes having all his coverage bundled in one place. He's okay staying in network, and he likes the idea of dental and vision benefits. Tom picks a Medicare Advantage plan with prescription coverage included. How do costs compare? Original Medicare with Medigap and Part D. You'll pay the Part B premium, which is $185 in 2025, a separate Medigap premium, usually anywhere from $100 to $300 a month, and a Part D premium, around $35 to $45 a month on average. You have very low out-of-pocket costs when you receive care. For Medicare Advantage, you still pay the Part B premium. Many plans have zero additional premium, though some do have a monthly premium. You will have copays or coinsurance when you get care. There is an annual out-of-pocket maximum up to about $8,000 in 2025. Enrollment deadlines, timing matters. Here's what to remember. The initial enrollment period, also called IEP, starts 3 months before you turn 65. It includes your birthday month and ends 3 months after. The annual enrollment period, which runs from October 15th through December 7th each year. You can switch plans or join a new one. The Medigap open enrollment period, a one-time 6-month window starting when you first enroll in Part B. During this time, you can buy any Medigap policy without medical underwriting. Here are some common pitfalls. Assuming Medigap and Medicare Advantage can be combined. You can't. If you have a Medicare Advantage plan, you also can't have Medigap. Ignoring provider networks. If you pick a Medicare Advantage HMO, you'll need to stay within network. And not comparing Part D formularies. Each drug plan is different, and your medications might not be covered the same way. So here are some key questions to ask yourself. Do you want the freedom to see any provider? Do you take expensive medication? Are extra benefits like dental or vision important to you? And what can you afford monthly? And in potential out-of-pocket costs? If you're enjoying this, make sure you subscribe to Mastering Medicare so you'll always have clear guidance to make smart Medicare decisions. Here are some additional tips for choosing. Make a list of your doctors and check which plans they accept. Review your medications and compare how each plan covers them. Consider your travel habits. Think about your budget, both premiums and possible out-of-pocket expenses. Use Medicare's Plan Finder tool to work with, or you could work with a trusted advisor to compare options. Remember, the best plan is the one that fits your health, budget, and lifestyle, not necessarily what worked for your neighbor or your cousin. Let's do a quick recap to keep things clear. Original Medicare includes Parts A and B. You can add standalone Part D plan coverage for prescriptions and a Medigap policy to help cover out-of-pocket costs. Medicare Advantage bundles your coverage into one plan, often with added benefits, but requires you to follow network rules. Costs and coverage vary widely, so comparing plans is essential. Enrollment periods are critical. Miss your window, and you may face penalties or be denied coverage. The right choice depends on your health needs, budget, and preferences. With the right information and a little planning, you can feel confident about picking the Medicare coverage that suits you best. Remember, Medicare doesn't have to be confusing when you have a trusted guide to walk you through it step by step. Thank you for watching today's episode. If you want to feel confident and informed about Medicare and your healthcare strategy, subscribe to Mastering Medicare now. And don't forget to hit the notification bell so you'll be the first to know when we release fresh insights to help you protect your health and your wallet. Have questions or want to share your thoughts? Leave a comment below. We read every one. If you'd like more one-on-one guidance, you can also schedule a complimentary 20-minute discovery call to get your questions answered and learn which strategies may be right for you. Just click the link in the description to pick a time that works best. Let's navigate Medicare together, step by step.